Alrighty, we're going to go ahead and get started. Good afternoon, everyone. I appreciate in advance everyone's grace and patience today as I am recovering from illness. However, this does not dampen my excitement for today's presentation or my gratitude for the technology that made today's event possible. For those familiar faces in the audience, hello again. It is great to see you. For those new faces, welcome. My name is Kendall Lee. I am the Program Administrator of the Maryland Emergency Preparedness Network, otherwise known as the EPN for short. The EPN is an emergency preparedness communication network operated by the Maryland National Capital Home Care Association, otherwise known as MNCA, in partnership with the Maryland Office of Preparedness and Response, otherwise known as OPNR. We provide emergency preparedness training, education, and resources to home and community-based providers, patients, and their caregivers. I'd like to extend my gratitude today to Executive Director Caitlin Hauk of MNCA, who's with us on the call today, and the staff at OPNR for their support, who's also joining us today. Your partnership makes this work possible, and we are so grateful. So thank you. Today, we are delighted to host our seasonal Lunch and Learn session with the Maryland Poison Center. This session is going to offer an invaluable opportunity to get acquainted with the Poison Center and gain insights on its role as a preparedness tool to keep in your tool belt. And additionally, we'll have the opportunity to learn some practical tips to prevent poisoning events for the remainder of this winter season. I'm incredibly excited to introduce our guest, but before I do so, let's cover just a few housekeeping items. For the recording, today's webinar will be recorded, and the link to the recording will be shared directly with attendees shortly following the event. The recording will also be made available publicly on our YouTube channel as well as our website. So look forward to sharing that soon. For the audio and camera portion of today's event, you will have complete control over your camera as well as your microphone. We kindly ask that you remain muted while the presenter is speaking. So if you could just now take the time to make sure you are muted, we would greatly appreciate this. Again, your camera is welcome to be turned on, but not a requirement. And for the Q&A portion of today's event, we encourage questions. Please submit them in the chat box. I will be monitoring the Q&A throughout the presentation, and we will address these questions during the Q&A portion of this event. Last but not least, it is time to introduce our speaker. We are privileged to have the lovely Emily Paterson, Public Education and Communications Manager from the Maryland Poison Center, with us today. And without further ado, over to you, Emily, to start your presentation. Thank you.
Thank you so much, Kendall, and thank you everyone for being here today. It's an honor and a privilege to speak to you today about the Maryland Poison Center and some winter poison safety tips. Even though it's been a weird winter once again, we did have a little bit of snow here in the more central region. But we are looking forward to continuing throughout the winter season and onwards. So without further ado, let's talk about what we're going to talk about today. So today I'm going to cover what a poison is. I like to start all of my presentations with defining that. I'll share a little bit about what and who we are at the Maryland Poison Center. Why there are poison centers that exist, when and how to call us, and who can call us, as well as how we help when people call and the other services we offer at the Poison Center. And then we'll get into our seasonal poisoning prevention tips for the winter, as well as sharing some resources with you all. So let's get started. So, like I said, I like to start my presentations by defining what a poison is to make sure that we're all on the same page. So a poison is anything that is used in the wrong way, in the wrong amount, or by the wrong person. There are a lot of things from this merely simple definition of what a poison is that could be considered a poison. So we think about medicine safety and misadventures and misuse of medicines, both over the counter and prescription. We talk about vitamins and supplements, all of those included in medicines. We have, there's our liquid medicine. We also have our household cleaning products, things we use to clean our homes that are in every home. Personal care products such as toothpaste, soaps, deodorant, things you use on your body during the day. We have bites and stings from venomous creatures. There are 2 venomous snakes in Maryland and 1 venomous spider. So we do manage bites and stings from these guys and any other creature in Maryland. We also manage plant, berry, and mushroom exposures, as well as food poisoning. And then we get into some more different things such as substances of abuse, chemicals, and stuff like that. So all of these are considered poisons and things that you can call the Poison Center about. Oh, I also wanted to mention here is that things are not just swallowed. We don't cover just swallowed poisons. We also cover things that get on your skin, such as those bites or stings, or if you have like an ointment that is prescribed for maybe a rash. We also manage ocular or eye exposures when things get into your eye, and also inhaled, so things that you breathe in. So why do poison centers exist? There are 55 poison centers across the United States and the territories. And we are here because poisoning is the leading cause of unintentional injury death in the United States. It has been for quite a while. And there are over 2 million human exposures reported to US poison centers each year. This is the data from 2021, and approximately 41% of those occurred in children under the age of 6. And of course, many more poisonings are unreported. So we here at the 55 poison centers about over 2 million human exposures in each year. So, like I mentioned, we are one of 55 poison centers. The Maryland Poison Center is the certified regional poison center for the state of Maryland. Our service area covers the state except for Prince George's and Montgomery counties. They are serviced by a neighboring poison center that I'll talk about on the next slide. So everyone, of course, is covered by a poison center. It's based off of where you're located when you make a call, but science isn't perfect, so sometimes things get misrouted, but that's okay. We're all poison centers that are all certified, who have this access to the nationwide phone number to be answered. So we are located at the University of Maryland School of Pharmacy in Baltimore. We are a telephone service strictly, so we don't have any on-site treatment or testing. You simply reach us via the nationwide phone number to be serviced via the telephone. So we don't do any in-person services for the general public. And we have provided poisoning treatment advice, education, and prevention to Marylanders since 1972. So we recently celebrated our 50th anniversary here at the School of Pharmacy. As I mentioned, Prince George's and Montgomery counties are serviced by our neighboring poison center called the National Capital Poison Center. They service our 2 counties in Maryland. They service some northern counties in Virginia, as well as the District of Columbia. So they're called the National Capital Poison Center. Again, same phone number, just based on where you are located. Who is the Poison Center? I always love to include the people who work here, their lovely faces, just to give you an idea that we are real humans behind the phone. when you call. So the people who answer our phones are pharmacists and nurses with specialized training in toxicology. Toxicology is the study of poisons. And our pharmacists and nurses undergo rigorous training. They manage about 2,000 human exposure cases and spend about 2,000 hours on the phone before they are allowed to answer the phone on their own and sit for this national exam to become a certified specialist in poison information, or CSPI for short. So again, these are not volunteers. It's not a robot you're talking to. It's not a phone tree you're talking to. These are real pharmacists and nurses with a lot of dedicated training who answer our phones. On staff, we also have board certified clinical and medical toxicologists. Dr. Josh King is our medical director. He is fellowship trained and board certified in internal medicine, nephrology, and medical toxicology. And Dr. James Leonard is our director of clinical services, and he is a pharmacist by training and is board certified in clinical toxicology. There is myself. I have a master's in public health, and I am in charge of the public education and communications here. We will also have a health professional educator who manages educating different healthcare professionals in various fields, such as the hospital, EMS, and kind of teach them about toxicology and the Poison Center. And of course, we can't do it without our support staff. We have business, IT, and office clerk folks that help us out. So we're roughly around a 30-person team. So pretty small, but mighty for all of the work that we are able to do and the impact we have here at the Maryland Poison Center. Our mission is to decrease the cost and complexity of poisoning and overdose care while maintaining and/or improving patient outcomes. Services that we provide are our telephone consultation for poisoning and overdoses. Of course, the most important thing and what we are very well known for. So that 1-800 number rings. It comes into one of these 5 cubicles here at our center, and a pharmacist or nurse answers and is able to manage the call. Throughout the call, we collect data such as exposure, what time it happened, the weight of the person it happened to, in case we need to do some calculations, any previous medical history, etc. Our data is confidential. We do not share our data out with anyone else. That is identifiable data. We do share like exposures, we collect data, but it's all de-identified. So information on specific patients is not shared, just the exposure data pretty much. Using our data and the other 54 Poison Center data, we are able to conduct research to better understand poisonings and overdoses that happen and be able to be sure we are giving the best care possible. We provide training to pharmacy students, medical students, and nursing students, as well as EMT students through our education program. We are, like I mentioned, at the School of Pharmacy, so we have a lot of really great relationships, and we work with the University of Maryland, Baltimore campus and other surrounding institutions to provide training and share our toxicology knowledge and educate others. We do have educational programs and materials for the public as well. You can visit our website to see a little bit more information about that. And I will definitely cover the materials at the end of towards the end of our talk today. We also maintain a pretty robust website, blog, and social media presence. I will again share all of those accounts so you can take a look at what we do and where we are on social media towards the end. So like I mentioned, of course, our telephone consultation is super important, but we also do a lot of other behind the scenes kind of services. So moving into when you should call the Poison Center, we kind of have this red, orange, yellow, and green about like kind of when things are happening, who you should call. So if you're having any life-threatening emergency symptoms, you definitely want to call 911. So this is like when people are unconscious, if they're having trouble breathing, you're not able to wake them up and get their attention, if they're having a seizure, or if they're having trouble talking or walking. 911 is definitely the place to go for those things. They have those trained individuals to be able to respond to and manage those types of symptoms. However, if none of those life-threatening things are happening, you are encouraged to call the poison center when a poison happens. So again, these are things such as medicine mistakes, making mistakes with personal care or household products. If you have a bite or a sting, or if you got into plants, berries, or mushrooms. So those are some of the things, again, that we can cover at the Poison Center. Reasons to call your healthcare provider. If you need to know the reason for why you are taking a medicine, your healthcare provider who prescribed it for you is definitely the person to go to. If you need help knowing when to start and stop taking those medicines, talk to your healthcare provider, as well as things for routine medical care, such as if you have a cold, the flu, COVID, anything else kind of medical wise, you'll want to talk to your healthcare provider. And then there are some things that your pharmacist can help with if you have a dedicated pharmacy that you go to, or you just wanted to talk to a pharmacist while you're at the store grabbing a medicine. They are available. So you can talk to your pharmacist about generic alternatives for different medicines that you need if you're having maybe a cold or a flu. They can help you pick which medicines to use. If you're experiencing any drug interactions, or if you're worried about having a drug interaction between two medicines you're taking, that's definitely something a pharmacist can help you with. And if you need any special instructions when taking medicines, such as if you are using a liquid medicine and you need to know how much to dose out for a liquid medicine and it's not clear, you can talk to your pharmacist about that. So again, calling 911 for serious life-threatening emergencies. But if you experience a poison and there aren't any life-threatening symptoms happening, go ahead and call the Poison Center. So some more examples of when to call when you're doing medicine dosing, such as if you have accidentally taken a double dose, or maybe you can't remember if you took your medicine and you are not sure if you should potentially take a double dose or just skip. So some medicines are okay to definitely take twice while others aren't. And our poison specialist can help you with that. Or if you've taken other wrong amounts of medicines, definitely a reason to give us a call. If you gave or took the wrong medicine, maybe that was someone else's medicine. Often we hear about spouses taking each other's medicine, or parents taking the kids' medicine by accident. So you would just give us a call and say kind of what the medicine was, and we'd be able to help you. Another example is if maybe you mixed up your morning and your evening medicines, we'd definitely be able to help out with that. We are able to identify pills. We do kind of, if there's another call coming on the line that we need to take, that's could be an emergency, we'll definitely take that, but we'll still be able to come back and help you identify a pill if perhaps you have that. Another example to call is if you need any help with IV infusions. I know with the EPN, they work a lot with home health, different personnel. So that's definitely an example that they can use us for as well. How to call the Poison Center. So if you don't already have the Poison Center phone number programmed in your phone, you can definitely take out your phone right now and scan this QR code. It'll bring up a contact, and then you can just press done and it'll save it right into your phone. So you have the Poison Center phone number in your phone. As I mentioned a few times, it is a nationwide phone number. So it should work based off of where you are physically located, but it's not a perfect science. And that number is 1-800-222-1222. So again, definitely program it into your phone if you don't already have it. You never know when you're going to need it, and it's best just to have it there. When you call, we can connect with interpreters in over 290 languages. So if somebody needs to use a different language, just call the number, state what language they need, and we can connect with an interpreter within a few minutes and be able to manage that call on that 800 number. And for our deaf and hard of hearing community, if they don't already call through an assisted device, you can definitely call us through Maryland Relay, which is 711. Who can call the Poison Center? The short answer is anyone. We answer calls from the public, first responders, and healthcare professionals. So of course, calling from the public, anyone is able to call us. We're open 24/7, 365. And they can call us using that 1-800 number. We do speak with first responders in the field using this interesting telephone here in the middle called an EMRC. It connects the first responder in the field with the referring hospital, and then with a specialty personnel like the Poison Center. And then we're able to have a three-way call and be able to manage a patient's care using this device. We also answer calls from healthcare professionals in a variety of different settings, not only the hospital and the emergency department, but any outpatient, any home care, any residential facilities, anywhere. So anyone can call the Poison Center. And a lot of people didn't know or don't know that healthcare providers call us too, because we have those special, like I mentioned earlier, special trained toxicologists, both clinical and medical, in addition to all of our poison specialists on staff. So they all work together to be able to give the best advice for patient care. How do we help? It is totally free to call the Poison Center. We do not ask for your insurance information. We don't ask for a credit card. It is completely free, and not many things are free these days. So definitely, if you need us, take advantage of our service. We are available 24/7, 365. No matter what is going on outside of our window, we are always available to help. It is confidential, like I mentioned earlier, to call. We work like your doctors or your healthcare professionals office with HIPAA. We do not share your information. We will not call Child Protective Services on you if your child gets into something at home or wherever you are. We won't call immigration if you're undocumented, anything like that. We don't share any of that information. We don't want to know it. We just simply want to help you with the poison that has happened. And our specialists are able to give you specific recommendations to your case. So a lot of people, when poisons happen, may go right to the internet to search for the answer of what to do. But when you search the internet, that gives you a ton of different search results. A lot of that information, you don't even know the validity of it. You're not sure. You're not able to tell like who has posted that information, if they're a trustworthy source. It may be outdated information, etc. And there are often a lot of different things that go into when a poison happens, such as how much was taken, how much the person weighs, etc., etc. And we're able to figure out all of that information and give you a specific recommendation to your case. It just saves a lot of time and worry for people if you just call us first and directly. We'll be able to get you that answer, get you off the phone within a few minutes, hopefully, and move on with your day. So we definitely don't encourage people to search the internet when a poison happens. Just take the few minutes to give us a call and double check that everything will be all right. Or if it's not, how they can help you with that. We do manage a majority of our cases at home or where they occur. So in 2022, we managed about 66% of our cases on site where they happen. So a lot of people also think that when a poison happens that they should immediately go to the emergency room or urgent care or something like that. But through all of our research and data on poisons and overdoses, we are able to know how much a specific weight of a person is able to have, where we don't expect symptoms to occur, and we're able to manage you via follow-up care at home or wherever the poison has happened. So again, a majority of our cases stay exactly where they are. We're not referring a ton of people into healthcare facilities when it's not needed. So our specialists have set, and all of our staff has set thresholds of where, when things should be seen by a healthcare provider in person. But we are able to do follow-up calls and safely manage people outside of healthcare facilities. So for our data loving folks, just wanted to share our 2022 data in cases by age, and also just to give anyone kind of an understanding of poison center usage. Back in the day, poison centers used to get a lot of calls about children under the age of 6. It used to be around like 70% nationwide. Those were what the calls were about. But as things have progressed, such as child-resistant packaging and other packaging laws and a whole ton of different laws, we now have seen a decrease in young children being poisoned by different things, but they still get into anything and everything. So we do see last year, we had 38% of our cases were in children under the age of 6. So still our biggest portion of cases. But as you can see, our adults 20 to 59 is not very far behind in 31% of our cases. We also have our tweens, our 6 to 12-year-olds. They accounted for 7%. Our teenagers accounted for 10%, and then our older adults accounted for 11%. So in 2022, we managed more than 37,000 cases throughout the whole year. 30,000 of those were human exposures. So we had 700 animal exposures and 6,000 information requests. So you can call the Poison Center if you are just looking for information. Similarly to when I talked about the pill identification earlier, if you have a question, we are more than happy to prevent a poisoning from happening in the future. We're able to help you with just poison information. But of course, if there are other calls coming on the line, we'll put you on a brief hold and be able to manage the other case. And then we'll definitely be able to come back and help you with whatever information you need. And also on the animal poison or exposures, we do get a fair number of calls about animals who have been poisoned. So a dog or a cat got into something, or another kind of animal got into something at your home, and you wanted to know if they would be okay. We are a human poison center, but we do have some limited data on different exposures and how that would affect animals. But there are 2 poison centers that are dedicated to animals. We have the Pet Poison Helpline and the ASPCA Animal Poison Control Center that we refer out to. However, they do charge for their services because they are so few and far between for veterinary toxicology. It's about $85 per call. When you call them, they'll ask for your credit card information before they're able to speak with you. But we have heard it's typically cheaper than a vet's visit. So if your animal ever gets into something, there are animal poison centers as well. So back to our data here, as I mentioned, we had about 66% of our cases managed where they happened last year. And then to give you an idea, 75% of those cases in humans were unintentional, but we did have 20% that were intentional. One other thing before we move off this slide I wanted to mention is, you see for our older adults, 59 years or older, there were only 11% of our cases. And nationwide, older adults only account for about 9 to 10% of cases, but they account for about 32% of our deaths nationwide, as well as a percentage of our more severe outcomes due to poisoning. That's due to a variety of reasons. Most older adults are on multiple medicines, and their bodies just aren't working like they used to. So they do often experience more severe medical outcomes from poisonings. But we definitely want people to call for older adults when they are exposed to anything. And speaking of our medical outcomes, this was our statistics from 2022. As you can see, calling the Poison Center for help results in good outcomes most of the time. So minor effect or no effect account for the largest percentage. So we had 62.2% of our cases, human exposure cases, resulted in a minor effect, which means maybe they had some side effects like a headache or nausea, vomiting, upset stomach, diarrhea, anything like that we would consider a minor effect. So not every time you call the Poison Center, you're going to have a moderate or severe effect. And like I said earlier, have to be seen in a healthcare facility. Most of our cases are have little to no effect. So to give you an idea of the top 5 cases of poisoning, these are not ranked 1 through 5, like most harmful to or deadly to least harmful. This is just simply what we are called about most. So number 1 thing that we were called about in 2022 were pain relievers. So these are like those over-the-counter medicines that you take for headache, body ache, any sort of pain you're having, pain reliever. Number 2 were household cleaning products, again, in a lot of people's homes and used a lot. Number 3 were antidepressants. These are medicines that are prescribed to help treat depression. Number 4 were cosmetics and personal care products. Again, things that are in everyone's home that people tend to use every day. So they're just out and about and used. And then number 5 were heart medicine. So any medicine that was prescribed to treat different issues with the heart. So again, top 5 things we were called about most commonly last year. There we go. Okay, so switching gears to talk a little bit about first aid for poisoning. This graphic on the right is kind of an infographic that we have available on our website to know what to do in the event that poisoning happens. So we go through something that was swallowed, something on the skin, something in the eye, or something inhaled. So let's take a look at each of those so people know what to do when these happen. So for swallowed poisons, we do not encourage inducing vomiting, either by sticking a finger down their throat or by giving them some sort of remedy to make them vomit. We do not encourage inducing vomiting anymore. We find it tends to cause more harm coming back up a second time than it is if it stays inside and we are able to treat it that way. So do not induce vomiting if someone swallows something. We encourage you to just gently wipe out any remaining substance from the mouth, give a small amount of water, just make sure they're able to swallow it, and then give the Poison Center a call. So again, do not give any sort of home remedy, salt, vinegar, lemon juice, milk, etc., to make them vomit. Just simply wipe out the mouth, give them a little bit of water, and call the Poison Center, and we'll be able to help you. If you got something on your skin, so like I mentioned, maybe you have a rash and you're using an ointment, but then that ointment starts to maybe burn or something, or if you are cleaning and a product maybe splashes up onto you, anything that gets onto your skin, we encourage you to remove any contaminated clothing and jewelry. Rinse with lukewarm water, not hot, not cold, somewhere in the middle for 10 minutes, and then give the Poison Center a call and we'll be able to assist you any further from that. If you get something in your eye, you want to flush the eye with lukewarm water. Again, not hot, just lukewarm. And there's a few ways that you can do this. You can pour it from a glass 2 or 3 inches above the eye, or you can use a faucet if you're able to turn it up right, or get in the shower and have the water stream down your face, and do that for about 15 minutes. You want to blink as much as possible, but do not force the eyelid open. If you force the eyelid open when it is trying to protect itself, it can cause cuts onto the eye, and you don't want to damage it any further. So if you can't get the eyelid open, you don't want to hold it open. Just blink as much as you can to get as much water in there, and then call the poison center. For inhaled poisons, so perhaps you are cleaning and mix 2 products together, which is something we often hear about. You want to get out to fresh air, and then if someone else is able, or if you're able to, once you get some fresh air, go back in and open the doors, and if there's a window, or you're able to turn on a fan in that area to ventilate the area and get that smell out. And then be able to call the poison center. But most importantly is to get to fresh air, get away from the fumes, and breathe in some nice fresh air. All right, now time to move on to our winter poison safety tips. So I'm going to cover a few things today, including carbon monoxide, cough and cold medicines, antifreeze and windshield washer fluid, ice melt, and then we'll talk a little bit about the big game coming up. So for carbon monoxide, it is more common during the winter months, but it can happen year-round anytime. Carbon monoxide is a colorless and odorless gas produced by the incomplete burning of fuel. It has the nickname the silent killer because you can't see it and you can't smell it, and it is very harmful. And the signs and symptoms of carbon monoxide poisoning are things that look like the flu. So things like dizziness, headache, tiredness, vomiting. Those are all signs and symptoms of carbon monoxide poisoning. And again, because you can't see or smell it, it's sometimes hard to know that that's what it is. So how does carbon monoxide poisoning happen? So as I mentioned earlier, again, it's produced by the incomplete burning of fuel. Some sources of those fuel could be gas and oil furnaces used to heat your home, wood and gas stoves used to heat your home or cook, fireplaces, portable generators and heaters, gas and charcoal grills, as well as vehicles and boats. Now, again, these are all things that we kind of use, but if they're not maintained properly, if they're not cleaned, if they're not used in the right way, that's when the carbon monoxide happens. So let's talk a little bit more about that and how to prevent it. So the number one thing, if you want to take away for carbon monoxide, is to install carbon monoxide detectors in your home. You want to have at least one on every level, if possible, of your home. But if you can only have one, we suggest to place it around the bedroom area so that people can hear it if they're sleeping and need to get out. Some products sold now are both smoke and carbon monoxide alarms. Some, there's all sorts of products out there now with like 10-year batteries, et cetera, et cetera. So definitely be sure to have a carbon monoxide detector in your home. That way it would be able to alert you when there's carbon monoxide in the air because, again, you cannot see or smell it. If you're using a generator, you want to keep it more than 20 feet away from the home. So it should not be near any window or door or the exterior of a home. It should be 20 feet away. So we see sometimes when the power goes out and people use these generators or they're doing construction, just trying to keep it away from the home so that it has enough air around it to breathe. Something that maybe people do during the winter months when it's cold outside is to have their vehicle turned on and running inside a garage. Even if the door is open, there's still a constricted area of where the vehicle is. So you should only leave a vehicle running if it's outside the garage area or enclosed area so that it has enough room again to breathe. So definitely do not leave the car running if it's inside the garage, even if the door is open. You do not want to use a stove or oven to heat the home. Again, something that happens, people do when the power goes out is that they use their stove or oven as a heat source. Again, this can cause the carbon monoxide to build up in the area. And then for all of our fuel burning appliances and heating systems, we recommend to have them checked yearly. Also your fireplaces to get checked yearly so that we can make sure that everything is running smoothly and will not cause carbon monoxide. All right, switching gears to cough and cold medicine. 'Tis the season. It seems like everyone is sick all the time during these winter months. So you may find yourself reaching for a cough or cold medicine product. Some things to remember when using these products. Number one is to read the label. Um, I know it seems kind of silly to read a label when it's a product you've been taking for X amount of years, but not all products are created the same. There's all sorts of different dosing, and the products have different ingredients in them. So you want to make sure you read that label before you take a medicine. You want to pay special attention to the dose, how much to take. We did do write a recent blog on measuring medicine safely and talking a little bit about doses, because sometimes the different measurements that they use for dosing can be very similar and very confusing. So we did write a recent blog about measuring medicine safely. I definitely recommend to check that out. You also will find on the label how often to take it. So the timing between doses. For example, it might say take every 2 to 4 hours as needed. But remember that not all products are created equal. Some products have a higher dose and should be taken a little bit further apart, while others should be taken a little bit closer together as needed, etc. It'll also tell you on the label how much the most amount that you can take within a 24-hour period. So definitely keep an eye on that. Another thing that not a lot of people know about is with active ingredients in cough and cold medicines. A lot of times cough and cold medicines are made with some pain reliever like acetaminophen. And then people also take a normal single product of acetaminophen pain reliever on the side. So be sure if you're taking multiple medicines while having a cough or cold, be able to read the label to see what the active ingredients are to make sure that you're not taking too much of any one ingredient, because that can cause you to overdose on the ingredient and have some harmful side effects. Also, the label will tell you about any drug interaction warnings. So if you take any prescription medicines, you may see on an over-the-counter product that it says, if you take this medicine or if you have this, do not take this or use this with warning, etc. So be sure to check the medicine label and see if there are any drug interaction warnings before you take a product. With cough and cold medicines, if it's either you or your children or someone you're taking care of, it's easy to leave the medicine out because you're giving it every 2 to 4 hours. So a lot of times people will leave it out on the counter, on the bedside nightstand, bedside table. So we always encourage you to put the product away in a safe place. So up, away, and out of sight is our golden rule for safe storage. So don't leave it out between doses, even though you're giving it back to back during the day. Still take the time to put it away so that kids, visitors, pets can't get into it. I wanted to share the difference between adult and children's medicines. There are medicines that are specifically formulated for children to take for cough and colds. So you do not want to give children adult medicine. Children are not just small adults. They need a totally different dosage. So use the medicine only if there is a dose available for your child's age and weight on the label. Also be sure for the young ones to make sure that it's a product that is made for children under the age of 2. And again, make sure it has their specific weight on it. Don't try and dose on their weight based off of an adult medicine versus a child's medicine. Make sure you read and have the specific dosing for the person that you're giving the medicine to. And then for dosing devices, a lot of the times, or some people use liquid medicines for cough and cold, and it will come with a dosing device. Be sure to use the device that it comes with because like as you can see up on in the picture here, it has like milliliters and teaspoons, but you may have another syringe that kind of looks the same but has different measurements on it, and they are not all created equal. So be sure to use the dosing device that comes with the medicine. Do not use a kitchen spoon to give medicine because it is not the correct measurement. It's not a true tablespoon or teaspoon. Be sure to use a cup or a syringe or any other dosing device that comes with the medicine. And if it's a prescription medicine that you got from the pharmacy, you can definitely go back and say, hey, I was prescribed this medicine and I lost the syringe and I need a new one. They'd be happy to give one to you. So be sure to use the exact device that was given with the medicine because they are different. And again, we talk a little bit about the dosing measurements on that blog I mentioned earlier too. Okay, so now talking about antifreeze and windshield washer fluid, a product that you commonly see in the store during this time of year. But it does have some danger to it because as little as one mouthful of these products can require treatment at a healthcare facility because of the ingredients that are in them. And then antifreeze and windshield washer fluid are one of the things that we see most commonly gets put into a different container. So because the containers they usually come in are so large, people are like, oh, there's only a small bit left. Like, I don't want to carry around, have this big jug in my car. So they pour it into a water bottle or another kind of drink container. And because of its color, it is very easy to mistake it for juice. So please be sure to keep antifreeze and windshield washer fluid in their original labeled containers. That way there can't be any mistakes. Because once again, the liquid can be easily mistaken for juice and soft drinks because of its color. And also these liquids have a sweet taste. So people may start to drink it and not really realize what they're truly drinking because it has a sweet taste and it's the same color as juice. But again, as little as one mouthful can require treatment. So be sure to keep these stored in their original labeled containers. And if they're keeping them in the garage, keep it up on a top shelf where children can't get into it. And then when you're using these products, you always want to clean up because, sometimes it's hard with that big jug trying to get it into the tube in the car. Be sure to clean up any puddles and spills right away for our furry friends because as you can see in this picture, it is when it spills or there's a puddle, pets may mistake it for or drink it up and can cause issues with pets as well. It is toxic to pets. And another thing to talk about, lastly for winter, is ice melt. You may call it sidewalk salt. There's so many different names for these products. This is a picture of a salt box in the city here, but you may have it in a little shaker container. So for our ice melt products, be sure to store them up, away, and out of sight. Again, if they're being kept in the garage during the winter or during year round, you want to keep it where little ones can't reach it or pets can't reach it. And then also be aware when tracking pellets inside of your home. So if you're using the salt on your driveway or on your sidewalk, be sure to wipe your feet off enough to not track it inside, because then pets and children may see the little pellets on the floor and be attracted to it. And they do sell pet safe products. So if you have pets around, maybe take a look at that just to minimize any problems. And lastly, we'll talk about the big game coming up on Sunday. It is this Sunday, I think, right? Or next Sunday? This Sunday? Clearly, I don't pay too much information. Sorry to all my football fans out there. But just wanted to quickly mention, since it is kind of coming up here soon, if you're having a party or you're just having friends over or you're going somewhere, just a few things to be mindful of during the big game. Alcohol, making sure if there are children around that you're keeping tabs on where your alcohol is. You're not leaving it on a table or somewhere that a child might be able to reach really easily. And then if you're going out, making sure that you're keeping tabs of where your cup is and make sure that nothing could be added to it. So just keep a close eye on your drinks. Cannabis, we also see if you're using cannabis products, just be sure to keep them separate from any other, if you're making edibles, keeping them separate from other kind of dessert treats. And then just making sure it's stored in a safe place when not in use. You don't want kids, pets to get into your products. And then if you're having a party and you have, you made edibles, homemade edibles, and they have it out on a table, make sure that it's clearly labeled so that someone that does not want to use that product don't accidentally mistaken it for a regular product. And then for our food safety, you don't want to invite food poisoning to your big game party. So just a rule of thumb to keep cold foods cold and hot foods hot. And you don't want to leave food out for any more than 2 hours. After 2 hours, you run the risk of bacteria growing and causing food poisoning. So just be sure to put any leftovers away before the 2-hour mark. All right, so we'll wrap up with our resources that are available to Marylanders. First and foremost is our website, mdpoison.com. There is a ton of information available on our website. We have information sheets on a variety of topics and seasonal topics. We have our newsletters that are sent out via email and archived as well. So if you see there's a red button on the right side that said receive newsletter. If you're not already signed up for our newsletters, you can go ahead and sign up there. We also have resources such as activity sheets if you're wanting to share information and teach kids about poisons and poison safety. We have activity sheets available for different ages. We have educational videos for not only children, but adults as well, available under the education tab and on our YouTube channel. And then you can also visit our website to order educational materials. And I will talk about those two main different groups. So one is our free home poison safety packet that you are able to order. Again, on our website, you can press that order materials and actually the get a poison safety packet button right there on our home screen. Or you can visit bit.ly/MPC packet. And be able to order a packet for your home. These are the items that come in it: a brochure, Mr. Yuck sticker sheet, a little information sheet, our contact card, and then a magnet and sticker, all for free. So just make sure, if you don't already have the Poison Center number somewhere posted visible in your home, that you can order one of these for your home. We also have other materials available if you're an organization and you want to share them with your community, or if you want to share them at an event. You're able to order free materials off of our website. We have stickers and magnets, our contact cards again. We have brochures available in English and Spanish, and we have our Mr. Yuck stickers as well. So these are just a few of our many items that you are able to order for free off of our website. And then you can find us on social media. We regularly post different information, different news topics, different prevention tips. We are on Facebook, X, formerly known as Twitter, Instagram, YouTube, and then we also have a blog. I did mention one of our most recent blog posts a little bit earlier. Our blog is called E-Antidote, and you can find us at blog.mdpoison.com. And then just as we wrap up here before we take questions, just a quick wanted to share that if you are able to evaluate the program today and share some feedback about how I did, how you liked the program, anything that could be improved, or any other topics that you would be interested in the future. This is our program evaluation, and Kendall graciously agreed to share this link with people after as well so that we can get to the questions. I will leave this up. And Kendall also shared some of our resources in the chat. Thank you, Kendall. So we can move on to our Q&A portion.
Okay. I have been monitoring the chat throughout the presentation. I do not see any questions posed in the chat at this time, but if anybody has questions, you're welcome to place them in the chat, or you're also welcome to come off mute and ask Emily any question you may have. So I'll just give folks a few moments.
Don't be shy.
Okay. Well, if you do not have questions at this time, don't hesitate to reach out to us. And that will conclude today's presentation. So I'm going to wrap up by sharing. Thank you so much, Emily, for today's incredibly informative session. We encourage all of you to connect with the Poison Center that serves, again, as a cost-free, trusted, credible resource that can help you before, during, and after poison-related events in your personal, but also your professional life. Any unanswered questions today will be followed up by Emily or myself, so you are invited to contact us directly. In the chat, you will find contact information for the EPN, the Poison Center, and Emily's information, as well as a link to the Poison Center's Winter Poison Fact Sheet as your takeaway token. And look forward to webinars materials coming your way soon. Until then, as an Emergency Preparedness Network, we wish you a safe and wonderful Wednesday. Thank you so much, everyone, again. Bye-bye.